What is the fear of pain and what are its impacts on daily functioning? Let's dive right in. So algophobia, or the fear of pain, is a scientific classification for phobia of pain, which consists of a constant and persistent fear of pain that is more powerful in comparison to a standard individual. Those who suffer from algophobia suffer a high level of anxiety from thinking of their pain and fearing that pain and not actually experiencing the pain. And this anxiety is often intense enough to trigger panic attacks. And it is also highly studied within the field of chronic pain, which is where it comes from. So now we'll dive into some theoretical underpinnings of pain. Algophobia occurs when the subconscious mind of an individual is constantly anticipating pain and provoking painful reactions. And now such behavioral responses to pain are strongly guided by two psychosocial factors, fear and anxiety. And then such individuals with higher fear and anxiety are more subject to infer their pain as damaging and aversive, which actually triggers the onset of avoidance behaviors. And these increases in fear and anxiety often result in emotional and behavioral avoidance responses that can cause disability, distress, and depression as well. And this is also very well explained by the fear-avoidance model, which was developed by Latham et al. In 1983, which basically just shows some coping strategies and their outcomes. Now we're quickly just going to focus just on the left cycle of figure 1 here. So an individual would have a painful stimuli, have that painful experience, and then thus what would happen is they would fear that pain, therefore avoiding that activity that could cause them that pain, and then that avoidance behavior could cause disuse, disability, or depression, and then because that activity may be part of their daily lives, they would be without it and then constantly going through a cycle of pain as they'll be fearing that, and they would have no positive coping strategy. So now, how does that actually affect our daily functioning? It causes you to avoid any aversive stimuli that may be part of your life, which can actually cause serious malfunction, and it has significant economic impacts and burdens, and has led to very high levels of absenteeism, and is correlated with very strong declines in physical performance, which heightens the severity of other disorders such as depression and anxiety, and has multiple impacts on productivity and efficiency, and also causes lesser engagement with your workmates and colleagues, which carries significant economic burdens as well. So what are some of the treatments for algophobia and the fear of pain? So we've got mindfulness-based stress reduction, which aims to reduce anticipated fear and anxiety, which works just by grounding you in the present moment, and it has been found to be quite effective. You've also got CBT, which focuses on graded exposure therapy, which has shown to be effective. However, it is quite difficult to treat algophobia as it's unknown, and it is very subjective. So, however, MSBR is a more effective treatment method. Point in time. So some simple take-home messages for today is to practice mindfulness to stay grounded in the present moment whenever you kind of get caught up in your own thoughts, and it's also to develop healthy coping strategies. And for any more information, please see the Fear of Pain Wikiversity page. Thank you.